been in photographs since 2018. I don't date. I haven't dated in about 3 years. I go through a lot of pain, a lot of discomfort, a lot of embarrassment.
Lovely lady who works really hard, who's not been able to smile, not been able to talk to people. Daily things in life that I take for granted that she just wasn't able to do. What we do is so easy to help someone like this, so they were like, okay, wow, if this is the starting point, imagine the difference we're going to make once we're done.
I just feel like I've kind of got my life back now with my teeth. I don't have to look up menus anymore before I go somewhere. I can just go and be like everyone else. Confidence has completely changed. I don't have to think about it anymore. My childhood dentist was fantastic. He was an older man, but I never worried about going to Dr. McAvoy because he always tried to save your teeth. But then Dr. McAvoy retired and I went through various dentists. And then I was 21 and I was living in Kilkenny at the time. I went to get my wisdom teeth out because my mouth was so full. I had fabulous teeth and I have big teeth like my dad. I went to get them removed, but he leaned up on the dentist chair and the anaesthetic obviously wore off, or there wasn't enough, and the pain. And he was like pinching the skin on my arm, he was pulling my clothes, and he removed all 4 in the one day. But I came out of there completely traumatized. Then at the age of 24, I got diabetes. And so with long-term insulin use, going to the dentist I was already then afraid of dentists. And I suppose the older you get, for me and many people that I do know, the dentist is just the sounds, the environment, everything about it, going in there, and I know they have a job to do, but they just don't seem to listen. I was so sensitive, and even the air gun that they use, the water is freezing. It didn't even hurt, it was painful to go to the dentist. When I lost my teeth from diabetes because they just became loose, especially my chewing teeth at the back, top and bottom, I wanted to get implants. I was really embarrassed about my teeth, and I went to the dentist and they said I wasn't suitable. So on top of being already afraid of the dentist, I was just told no at every corner. And I suppose when you're diabetic, a lot of people will relate to this. You're told no about a lot of things. You're told no about sugar, you're told no about chocolate, you're told no about smoking, you're told no about going places and insulin and drinking, and you're just told no about everything. It was really disheartening because I could see my face starting to fall. Losing my chewing teeth had a massive impact on me. And I suppose the dentist didn't help that at all. I lost, not so long ago, my front tooth when I went to get dentures fitted. Because all of my bone and gum are degenerated, I couldn't even get clip-in dentures with the metal on them, but I just had to get ones that glue in at the top and ones that snap in at the bottom. And while they're beautifully made and everything, I'm 43 and it just has such a huge impact. But going to the dentist and just being constantly told your gums, your bone have degenerated. If you do get implants, we have to do bone grafts, we have to do gum grafts. And just for a person like me, I suppose the recovery time, they just always were negative about the diabetes. They didn't ever say there was a solution for sedation or doing it. They didn't ever say that there was a way around it. It was always just, it's not possible. My family photographs, I'll generally stand at the back and smile with my mouth closed. And then I like the picture taken far away so that you can't see my teeth. There's been a few photos that family have taken and I've had arguments with my family to take them down because especially when I didn't have the denture, this one here, you could see it was missing. Yeah, I get really upset about it. I used to be a chef years ago, I'm not anymore, but I accept the fact that I can't eat things like steak when I'm not at home. I eat steak at home, but I don't eat steak when I'm out. Pork as well, things like that, anything chewy. Even when I get takeaway in work, it's things that are soft because I'm always worried about the dentures moving. While dentures are a solution, I feel like it's really held me back. And then I went to Truly Dental. I entered the competition. I saw it on Facebook. The one thing that stood out for me on Facebook about Truly Dental was they said that it doesn't matter how long you've been wearing dentures or the bone that you have or the gum that you had, and I thought, oh my God, maybe. So I entered the competition. Hi, my name is Marion. I would love to be nominated for this amazing competition. Nearly passed out when I saw it. Yeah, they hurt constantly. I'm just always afraid of when's the next one going to fall out. I would love to be nominated, please, please, please. And if nothing else, thank you for taking the time to watch my video. Thank you, bye. And I won. which is pretty amazing to me because I wouldn't win a kick in a stampede, to be honest. But the day I went up to Truly Dental, the very first day, and the minute I walked in, people were just kind. They were ordinary, they were professional. The man who took the x-rays of my teeth and everything, he was just as if he'd seen this all before. He didn't say anything negative. He didn't say to me about my bones, my gums, nothing. Felt like a very surreal experience.
My first encounter with Marion was actually before I even met her. We saw the video and her video submission. It was really emotional because this lovely lady who works really hard, who's not been able to smile, not been able to talk to people, and she kind of referenced, daily things in life that I take for granted that she just wasn't able to do. A lot of full arch stories we see, they start with those points, but hers really hit home because the video format really makes it that much more emotional. And then when I met her, very kind lady, very happy lady, but she's scared to smile too wide because she didn't want people to see her teeth. She's scared of her teeth falling out. She's scared of her teeth getting looser. She's scared of eating. And that's just something that naturally the instincts are that what we do is so easy to help someone like this. So that we're like, okay, wow, if this is the starting point, imagine the difference we're gonna make once we're done.
One thing I do want to say is that anyone that is like me, has gone to a dentist where there's been pain, where you're not listened to, Truly Dental is completely different. And I say that as a very ordinary person, a person who has had nothing but negativity going to the dentist, a person who has had nothing but being told no.
Marion has a background of type 1 diabetes, which is something that has to be controlled really well. Diabetes affects how implants heal. It affects how everything in our body heals. And that means that people may not be comfortable doing the level of treatment that we do because they'll fear the aspect of failure. With the amount of bone loss she had, the amount of gum loss she had, having wearing dentures, the diabetes, the gum disease, these things all add up and make her surgery a bit more complicated. Traditional kind of implant approaches where you graft, wait for healing, then place implants, things like that, in her case, people would be worried with her diabetes. I guess the reason that we were so capable and ready to help her is that we do all on 4, all on 6, which is a graftless, immediate procedure. What it means is we can bypass these infections by cleaning them out. We can bypass the grafting by placing implants into the good quality bone. Having the facility that we have in Dame Street, being able to monitor the patient while she's sedated to make sure that everything's in order. Having the medical background I did, being able to deal with her diabetes, all these kind of things played a role in us being able to help her where maybe other people weren't. And that's what we pride ourselves on, is that as a place we've made it available for everyone or anyone who needs implants with any background. We can help them here, and Marion was kind of the first step of us showing people that we're here to do that.
When you've had such a negative experience, you really notice when people listen. You don't forget it. And it makes you feel seen, it makes you feel heard, it makes you feel like there's hope when I had none. I really thought that this denture, I don't know if you can hear it, but because the upper plate, it does affect my speech, and it kind of almost gives a hissing sound. But when I have it out, I can speak normally. It affects everything. It affects your confidence. I know watching previous videos from people who have gone to Truly Dental, they talk about confidence, and that has massively been played a part in me dating, in me going to family functions, in speaking on the phone.
So when Marion came to me, she was quite deep in the stages of gum disease, so her teeth were quite loose, they were wobbly. Because of this, she'd lost a lot of the back teeth. That had put a lot of force on the teeth that she had left in front. She was wearing dentures which weren't stable because the bone loss, the gum loss that came from this diabetes and gum disease, and that kind of accelerated everything. I guess the main problem for her is that our mouth functions as a system, and in her case, each part of the system was slowly falling down like a domino, and it was kind of leading to more and more catastrophic events, where now she was at a point where the teeth just didn't have life left in, and that's kind of where we started from.
My teeth and gums hurt constantly. It affects my speech because of the palate being so thick, and down below then, this one hurts to put it in, but it has to hurt because it needs to be tight. It takes about 15 minutes to put them in properly and do my oral care. I usually eat breakfast before I put them in and then I have to go to work. I work 12-hour shifts, so it can be really uncomfortable. When I take this one out, I find that immediately I need to go and brush my teeth. Whatever about the top one down here traps particles of food. The taste in my mouth is awful. So you can just imagine what that does to your confidence, but it's unavoidable. These are all things that nobody says out loud. That's what happens with a denture. They're not your teeth, so you can't feel what you're chewing. But this one back here is kind of my main chewing tooth. I only have one, so there's so much pressure on that. It kind of makes me emotional, but like the pain is horrendous, but I have to eat. I can't not eat. I'm kind of determined not to give up, all of the foods I enjoy, so if it takes me longer, I do that. But I wish I could just eat without thinking the way I used to, and the sensitivity. Until Truly Dental, the thoughts of going to a dentist, because I have to go to get them clean so that to avoid losing more, which is inevitable anyway. Oh, the pain is just incredible, and they don't listen. Dentists have to do their jobs. It's not an easy thing. Like, they have to use the flosser and the air gun. The air gun is just, oh my God, it's like somebody just hit you with an axe. It's so sensitive. That's the part I hate the most. Or the drilling.
When Marion first came to me, her main thing was she wanted to smile and eat. And if we kind of take the protracted old school approach, there's lots of risk, lots of steps that can fail. So we kind of talked about all-on-4 full mouth implants with our kind of True Smile workflow. The idea being that it's graftless, it's immediate, we can bypass all those things that carry high risk for Marion, and we can kind of give her an immediate solution to all the problems in one swift procedure. We kind of discussed the diabetes, how that affects it. Yes, it makes the rate of non-integration of implants a little bit higher, but we can manage that by keeping sure that her blood sugars are well controlled. And during the kind of phases of eating where she's liquid food, soft food, she can also manage her diet to maintain things as well. So we kind of talked through all-on-4, we talked through the old school approach, we talked through long-term periodontal treatment, but because of the state her teeth were in, none of those things really were an option apart from all-on-4. That's why when we kind of discussed it and we went through it, we talked about what we call our advanced package, which is 6 implants top and bottom, because she's a bit younger. We wanted to give her that bit more security and support, and then we wanted her to have that bit more aesthetic result, or those beautiful teeth that come with that as well. If you think about it, for Marion, the foundations of her teeth were gone, or the foundations the house were built on were slowly collapsing, so as a result the house starts to collapse too. Teeth were breaking, they were loose, they were falling, dentures were loose because the architecture of the bone underneath wasn't there. So the idea with all-on-4 is to remove those unhealthy teeth. We then place 6 new implants which act as the new foundation, and then we place the fixed set of teeth, both top and bottom jaw, for her. What this does is this gives new foundations for a new set of teeth. These don't behave like her old teeth did. These are a new form of teeth, so the ability to clean them is easier, the ability to maintain them is easier. The implants are placed in good strength and good quality bone, which gives them that bit of longevity as well. And also we made it as cleansable as possible so that we don't repeat the mistakes of the past. We want to make sure that her teeth are cleanable so that she can maintain them. And then we also made sure that we gave her the correct number of teeth. So we gave her 12 teeth, top and bottom. So that's everything she can eat with, she can smile with, she can chew with, but she doesn't have to clean too far back as well.
I can't even imagine what it's going to be like getting them, because I've just dealt with this for so long. But I keep watching the videos on Facebook of Truly Dental, and other people that have gone through it. Yes, they've done videos and everything and they say they're confident, but you can really see it. You can really see it in just the relief and the confidence and the comfort that they have now. Everyone in the videos says, just go and get it done. I think people should really embrace that part of those videos, because it is the truth. Because going into Truly Dental was, I just can't tell you the amount of things that it's going to affect in such a positive way. I considered getting implants done before. What people don't take into consideration is that if I had to get bone grafts, if I have to get gum grafts, get separate teeth done, implants wise, that's months of recovery. A diabetic takes 3 times longer to heal. If I get any infections, I'm done for. It could undo the whole thing. With Truly Dental now, I've taken out all of that. I don't have to get the bone graft. I don't have to get gum grafts. I don't have to worry about any of that. They're all on 6 screws. So it's just one surgery for me, less risk of infection, less risk of being sick, less taking time off.
The standard kind of healing process we tell people is that it's a 3-day healing post-surgery, but it's a 3-month healing from the day of surgery to your final teeth. Normally people have their surgery, soft food for a month, and then they have their final scans and their final teeth inserted at 3.5 months time. In Marion's case, we kind of slowed things down because we monitored how her implants healed with the diabetes. We asked her the same periods for some soft food. We asked her to be more rigorous with how she cleans them. We asked her to stay on top of her sugars as well. So when she was in a soft diet, quite often there's a tendency to go towards porridge, ice cream, yogurts. For her, these aren't correct because they'll ramp her sugar up, and this will mean her implants won't take. Speaking to her, to her GP, planning it out, we were able to determine the diet that gave her the best sugar control, the best hygiene, and the best maintenance. And these then kind of all led to a simpler healing period for her. Not everyone's healing period is the same, but if we can standardize all the things that lead to better healing, then we can make sure our patients have as comfortable a healing period as possible.
I've no more tooth pain or gum pain. Just everyone is really proud of me, and everyone's taken an interest in it and feel a lot more confident. Can't wait to get my new set of teeth, but even looking at them in the morning, just having a full smile. My jaw is a little bit sore because I'm not used to having teeth back here now, but it's just such a nice feeling to have a full set of teeth. Everyone said how natural they look. Everyone just said how much more I'm smiling. I'm gradually coming on to soft foods now, and it's just amazing to be able to use my whole mouth and not have any pain when I'm eating. I don't feel like I have to turn a certain way to smile at someone or turn away, which was often the case. Very natural, that was my first thought. And they looked exactly like my own teeth used to. Even sitting on my gums are very comfortable. I know I had stitches, everything was just so comfortable, and I was so well looked after, and the follow-up was amazing. In the sense of getting better, within inside 2 weeks, even 10 days, they had settled down completely. And it's not even the teeth themselves, it's your mouth. Just didn't expect it to be so straightforward and to go back to work, no problem. Smiling at everyone now. My mum and my best friend were here with me that day, and they just thought it was amazing. And then I sent a picture to work, to all my friends in work, because they were working that night, and I sent in a picture of my teeth, and they were all like congratulating me and saying well done, and that was huge for me, like, because they were all like, send us a picture, and I did, I took a picture. That was the day of the surgery. When I got home, come to the consultation. This is a place like no other. They know people are scared. They treat you with respect. They listen to you, which is just such a huge thing. The consultation, I know that there's payment plans, everything like that. It's not scary at all in here, and they literally tailor it to you. It's not as invasive as going to a normal dentist. In my experience, and it was all scans, there's nobody hurting you. They take care of you. If you are in pain, they help you. There's people for follow-up. The follow-up care is just as amazing as the care they give you during surgery.
We often take for granted what our smile and what our teeth do for our daily life and our confidence, and what we really value here is the fact that we're able to restore that smile, that confidence that a person has. Quite often people don't know that full mouth implants is an option for them, so they think that they have to live with how their teeth are, how their dentures are, having treatments that just will not fix the base problem. And what we ask is that anyone who feels that they need a smile rejuvenation, or who feels that they want to get rid of their dentures, or they feel that they're not a candidate for implants because of X reason or Y reason, we ask them to come in so that we can talk to them, take the scans, take that data, and create a plan for them, because there's nobody who can't have dental implants, and there's nobody who doesn't deserve to smile. If we can take all the data points we need, and we can take all the emotion of this beautiful journey that leads to someone's rejuvenated smile, we want to help everyone we can. Our founder always preaches about eradicating edentulous. The idea is that we want nobody to have a denture, we want nobody to be without teeth, we want nobody to not be able to smile, we want everyone to eat a burger, everyone to eat a steak, and all we ask is they come in for a checkup, and we take it step by step from there.
I can eat anything I want now without thinking about it. Even in work, smiling a lot more. My family has said I'm smiling a lot more. They said my face has changed. It's filled out, I think. They meant what they said in this competition, that it was life-changing, because it is. I had very little social media. For the first time ever, my best friend has a photo of us together. I wouldn't go to family events because I didn't want to smile, or I'd go and I just wouldn't get in any pictures. So there's no pictures really of me, my nieces and nephews when they were younger, which I'll have now. And just going out more and enjoying myself more, and just daily life is more enjoyable for me. Certainly feel like I could go out socially more now, and I'd be old school that way. I think I'd like to meet someone kind of out and about, whereas I wasn't out and about before, but I'll definitely be out and about more now. These teeth are actually based on my own, like, because of the scans, so I feel like they're the same shape. I have the smile that I used to have years ago, but obviously it's incredibly better.
I know we were chatting about how you had that photo with your friend. How did that feel to take that photo with your best friend?
Yeah, she was very excited about it. I still am getting used to photos being taken of me. Yeah, we were both emotional about it. I had it on my wallpaper on my phone. for a few days, and she still has it on hers. We were laughing out loud in the restaurant, which is something I haven't done in years. And I used to have this big, massive, wide smile, and like looking at pictures throughout the years, I stopped smiling. Should have done it sooner. Even for my own health, I think I should have done it sooner. When I came in, they asked me about my fears. Every other dentist I've been to, you know, you say to them, it's hurting here, and they literally stick a hook up inside, like, does it hurt? Yeah, I've just told, it's all those little things that truly do, that are truly brilliant. If you have fear, if you have an autoimmune disease, if you have low confidence, if you can't eat and it's affecting your health, here is the place to come to overcome all of that. It's not just once you're treated well and you're going back and you're a bit nervous about the next step, however big or small that is. You're treated the same way and like a human being every time you come here. That is my honest opinion. From the minute I stepped in here, it's just gotten better and better and better. It hasn't been up and down where I felt lows at any time. It's just been straight line happiness. From not living to living. I cried, like, obviously when they showed them to me, and I was like, thanks, Jimmy. And to be honest, I wanted to squeeze the man, like, do you know what I mean? Like, because he doesn't know what it means. Yeah, I think there's a lot of thanks that are owed to everyone here for that, from me. Thank you.